Good afternoon, everyone. I am here to present my paper, a cross-sectional study of dry eye disease in diabetic patients at a tertiary care center in Kerala. Diabetes is considered as the global diabetic capital, and the Lancet study has said that there is a fourfold increase in diabetics across the world, and among the 5 countries, India is one which contributes to half of this population. Diabetic retinopathy is considered as one of the leading causes of blindness in 20 to 70-year-olds. Dry eye disease is present globally in 6 to 34% of the population, and recently, dry eye disease has been increasingly reported in diabetics, affecting their quality of life. There is no gold standard model to determine dry eye disease severity, and its association with diabetic retinopathy is not well described, and studies on the same are sparse in our area. Hence, the relevance of the study to understand about the complications of diabetic retinopathy, its association with dry eye disease. We have aimed to find the prevalence of dry eye disease and its severity in diabetics, and also to find a correlation between diabetic dry eye disease and diabetic retinopathy and between their severities. This was a cross-sectional study including all previously diagnosed diabetics in our ophthalmology department of our tertiary care center of 203 patients determined by Devi RSU et al. Over a period of 1 year. We have excluded any patients who have underwent ocular surgery, who are contact lens users, who have local or systemic diseases known to cause dry eye disease or medications known to cause dry eye disease, and pregnant women. We have collected our data after written informed consent. We have taken a comprehensive history, and after ophthalmological examination, we have assessed dry eye disease subjectively using the OSDI, which is the Ocular Surface Disease Index questionnaire, and graded accordingly, and also objectively assessed for the tear functions using the Schimmer's 1 test and the tear film breakup time. Dry eye disease was diagnosed and severity graded after the average values of taken, and diabetic retinopathy was graded according to the ETDRS classification. Data so obtained was entered in the MS Excel and analyzed using the IBM SPSS software, and considered statistically significant if probability value was less than 0.05. Coming to the results. This is the distribution of our study. The bar graph shows that the mean age of the population was at 56.02 years, and we had a majority of the study population was males at 58%. We have found that the mean of the study population of duration of diabetes was at 8.81 years. We have found that 60% of the study population was affected with dry eye disease. Distribution in the dry eye disease in the study population showed that most frequency of dry eye disease affected were within the age group of 51 to 60 years. And we have found that there was a female preponderance in dry eye disease, but though it was insignificant statistically. Both age and duration of diabetes was statistically significant with the dry eye disease. This shows the comparison between the subjective and objective assessments of dry eye disease, which shows that by OSDI score, there was 49 people who were symptomatic. This is the grading of dry eye disease. We had seen a majority of those affected with mild dry eye disease. Proportion of diabetic retinopathy, we had found the prevalence of diabetic retinopathy within the population was 53.2, and most had moderate NPDR. Distribution of diabetic retinopathy was found significant with age and duration of diabetes, but insignificant with the gender. There was a significant increase in occurrence of diabetic retinopathy with age. 52% were males and 55 females. So this is the association of dry eye disease with diabetic retinopathy, and we have found that it was at 44% and statistically significant. The associations of both severities of dry eye disease and diabetic retinopathy was also found significant statistically. Coming to the discussion, Our study had a prevalence of 60%, which was a little less than the prevalence observed in the parent study. And we have found that the other studies had a lower prevalence of dry eye disease, unlike Sushilojeha et al., which showed a prevalence of dry eye disease at 76%. Our ages, mean age of the study groups were comparable to other studies, and all studies that I have analyzed with association of dry eye disease and gender was found insignificant statistically, though we had a female preponderance. Duration of diabetes was found lower, and that was at 8.81. Prevalence at diabetic retinopathy was also lower at 53%, unlike 70% at Manwith et al. Most studies correlated dry eye disease and diabetic retinopathy statistically significant factors, and including the severities of dry eye disease and diabetic retinopathy was also statistically significant when compared to Knepp et al. So we come to a conclusion that there is a significant prevalence of dry eye disease in diabetics, and it has the severity of diabetic retinopathy and diabetic retinopathy and dry eye disease paralleled with each other, which we can see that routinely we have to screen diabetics for dry eye disease as well, especially those affected with diabetic retinopathy. Some limitations of a study are absence of control group, small sample size. Larger sample size are required to elucidate a better relationship with dry eye disease and diabetic retinopathy. These are my references. Thank you.
Anu, thank you for your study and for explaining it. I have just one question. Here we were trying to see if diabetic retinopathy or prolonged duration of diabetes and the relation with dry eye disease. So very good. One thing that you have masked in your study is that mild, moderate, severe NPDR as well as PDR, you say, the figures showed that all of them, about 50% of them only had dry eye disease. What I'm trying to ask is, will the severity of diabetic retinopathy affect dry eye disease in any way?
Since both have a microvasculopathy involved, it can be assumed that or come to a conclusion that because microvasculopathy is involved in both diseases, they can be a confounding factor as well as a causal relationship. But we will need prospective studies to rule out that diabetic retinopathy is a cause for dry eye disease and to associate a proper severity to.
What I'm asking is worsening of diabetic retinopathy and dry eye disease.
Yes, sir. It has. From my study, it was significant.
Do you think a treatment can change this, this incidence?
Incidence, we'll have, yes,
control,
because I think we have to control diabetics actually, the diabetic glycemic status, which in turn is the root cause of every complication of diabetes. So like that, probably we'll be able to, but there are many confounding factors like the age of the patient, if they are diabetic, the duration of diabetes. So many of the confounding factors do come into play, but we can aim to decrease the incidence of dry eye disease.
Thank you.